Everyone, welcome to this explainer. Today we're zooming in on something incredibly practical, entirely essential, and, well, literally pulsing through you right this very second. We are talking about the human cardiovascular system, specifically mapping out the body's pulse points.
So, quick question. You have 9 vital pulse sites on your body, but do you actually know where they all are? We're completely stripping away the long academic preamble today. Instead, we're taking a fast-paced head-to-toe anatomical tour of these 9 specific sites. We'll look exactly at where they're located and exactly how they're used in the real world.
Okay, let's dive right into this. We're starting at the very top of the body with the temporal pulse. As the name suggests, this one is located over the temporal bone. To find it, you just look superior and lateral to the eye. Basically, right there at the temporal region of the head.
Now, you might be wondering, why on earth would we check a pulse on the side of someone's head? Well, this site is heavily relied on in 2 very specific scenarios. First, with infants. Sometimes that radial pulse on the wrist is just way too difficult to palpate, or feel, so we go to the temple. Second, it is absolutely crucial for assessing circulation after severe facial or head trauma, especially when you need to check blood flow after wrapping extensive head bandages.
Moving right down the body into the neck, we arrive at a site you have definitely seen in countless medical dramas, the carotid pulse. Its exact location is at the medial border of the sternocleidomastoid muscle. That's a mouthful, I know, but it's just that prominent, thick muscle running down the side of your neck. The pulse point sits right there in that inner groove.
Because the carotid is a major central artery, it's the absolute go-to site for critical, high-stakes emergency situations. Clinicians rely on it for cardiac arrest assessments, for evaluating patients in shock or those with severe hypotension, which just means dangerously low blood pressure. And, crucially, it's the primary site you check before initiating CPR on an adult.
All right, shifting our focus down the body, we arrive at the arm and the brachial pulse. You'll find this one in the antecubital fossa, that is just the fancy medical term for the inner groove of the upper arm, right there at the crease of your elbow. If you've ever had a physical, I guarantee you are very familiar with this spot.
What's really fascinating here is the dual nature of this site. For adults, this is your standard, everyday location for blood pressure measurement. It's exactly where the stethoscope goes under the cuff. But for infants, this is actually the primary emergency check site. It's used to assess infant cardiac arrest and is the required pulse check before beginning infant CPR.
Tracing the system just a little bit further down the arm, we hit the most famous pulse point of them all, the radial pulse. This one is located on the outer aspect of the wrist, resting right over the radial bone on the thumb side of the hand.
Because it's right there at the end of the arm, it is incredibly easy to access. You don't have to ask a patient to remove any clothing, which makes it the absolute gold standard for routine vital sign assessments. It's simply the most accessible site we have for establishing a general baseline heart rate.
Okay, let's move inward now, tracking how this system builds as we reach the core of the body. Here we have the femoral pulse. This is a massive artery, and the pulse point is deeply located in the groin fold, specifically at what's called the mid-inguinal point.
Because of its sheer size and its central location, this site handles the heavy-duty clinical work. It is vital for emergency assessments during cardiac arrest and shock, and it's the primary pulse checked during child CPR. On top of that, it's used to assess general blood flow down to the lower extremities, and serves as the main access point for major femoral artery catheterization procedures.
Dropping further down into the lower body, we find the popliteal pulse. If you visualize the back of the knee joint, that hollowed-out area right behind the knee is called the popliteal fossa. The pulse is situated deep within this space.
Checking this specific pulse serves 2 main functions. First off, it provides an alternative blood pressure measurement site directly from the thigh if, for whatever reason, the arms can't be used. Second, it really helps clinicians evaluate peripheral arterial disease. Basically, they're checking to ensure that arterial blood flow isn't getting restricted on its journey down to the calves and feet.
Continuing our descent right down to the ankle, we find the posterior tibial pulse. The location here is super specific. It's on the inner side of the ankle, situated just behind and slightly below the medial malleolus. And if you're wondering what that is, the medial malleolus is simply the anatomical term for that prominent inner ankle bone.
This pulse is heavily monitored to assess overall foot circulation and peripheral vascular health. It is an especially critical checkpoint for routine checks in diabetic patients, making absolutely sure their feet are actually receiving adequate blood flow.
and it's strictly monitored during recovery after vascular surgeries. Finishing up our physical descent, we reach the final distal pulse point, the dorsalis pedis pulse. You're going to find this one right on the top of the foot, running along an imaginary line drawn between the first and second toes.
And this brilliantly illustrates how we verify that the very ends of our circulatory system are working properly. We check here to assess general perfusion, which is just a fancy word for blood flow, to the feet. Importantly, this is the primary spot checked after leg surgery, major trauma, or the application of a leg cast. We have to make sure the swelling or the cast itself isn't too tight and cutting off circulation to the foot.
Now hold on, let's zoom right back up from the foot, all the way back into the center of the chest to look directly at the heart itself. This is the apical pulse. In a typical adult, you locate this by finding the fifth intercostal space. That's the space between the fifth and sixth ribs at the left midclavicular line, right over the apex of the heart.
But wait, I have to pause here because this is genuinely fascinating. Human anatomy actually shifts as we grow. For infants under 2 years old, the apical pulse is actually located slightly higher up on the chest, at the fourth intercostal space. How cool is that?
Listening directly over the heart via the apical pulse is absolutely crucial for thorough physical assessments in infants and young children. Furthermore, in patients of all ages, it is a strict requirement to check this precise central pulse before giving potent cardiac drugs, like digoxin, just to ensure the heart rate is safe enough to handle the medication. This also brings us to a really vital clinical concept called the pulse deficit. Sometimes, clinicians will check the apical pulse directly on the chest while simultaneously checking the radial pulse at the wrist. They're comparing the central heart rate against the peripheral wrist rate. If there's a difference between those two numbers, that is a pulse deficit. It means not every heartbeat is actually strong enough to pump blood all the way out to the extremities.
So we've just mapped the body from the temporal bone all the way down to the top of the foot. You now have a complete, structured picture of how and why we access the cardiovascular system at these specific checkpoints. Considering everything we've just covered, which of these 9 pulse sites would you confidently reach for first in a critical moment? Keep that anatomical map fresh in your mind. Thanks for joining me on this explainer, and stay curious.